Hello and welcome. I am Dr. Anil Joshi. Welcomes you to my series Learn Radiology with Dr. Anil Joshi. Today's topic is based on radiophysics, that also on CT and in particular types of CT. We have covered this topic in more than 3 to 4 lectures in which different type of CTs are covered. In this lecture, we are going to cover dual energy CT, dynamic CT and CT perfusion studies. Before going to the lecture proper, first disclosure, acknowledgement and disclaimers. We acknowledge with thanks all of from them we have got this material. This is going on in our department since long time. We are using it for our teaching purposes. However, certain material has come from the net which we have confirmed as royalty free. However, still we acknowledge them with thanks. With that introduction, let's get going to the topic proper, that is the types of CT scanning, dual energy CT, dynamic CT and CT perfusion studies. In addition to that, some applications of CT radiotherapy we are going to see. There are not much today, however still whatever are there, let's see them. So to start with are dual energy CT. Standard computerized tomography scanners use normal X-rays to make a cross-sectional slice-like picture or the image. All the basic behind this in terms of physics we have seen in some different lectures. A dual energy CT scanner is fairly new technology that uses both the normal X-rays and also a second less powerful X-ray generating unit, that is tube as well as a detector, to make the images in more details. We are going to see how these two tubes along with two type of or two sets of detector works. This gives dual energy CT scanner additional advantage, that is because it is scanned in two different planes at two different energies, advantage over the additional CT scan for a wide range of tests and procedures. Iodinated contrast is a commonly used contrast agent. In dual energy also we use it. Now CT scan can selectively increase the effect of procedure and better images of the blood can be produced. So that application is in angiography. The images with and without contrast agent can be obtained using a single examination instead of two separate examinations. We save the time, we save the contrast, and most important thing, we save the radiation. So these are the advantages of dual, that we can have in one set both plane as well as contrast. Now for determining precise treatment, presence of kidney stones, it is important to know constituency of the stones, because on lithotripsy often they know what is the CT value, whether they are seen on CT or not. If we don't see a stone on CT, then they cannot plan it. So best we should use a dual source in which those who are routinely not visualized can also be visualized by this technique. It can significantly improve imaging quality if patient has metal in the scanning area. You know it, that it produces artifacts, and these artifacts can obscure our examination details. We want to know around the implant, but that all area is obscured by the artifacts. Now this is the diagrammatic presentation. What we are seeing in the black is the standard field FOV, and what we are seeing extended is by the cross lines. Now acquisition in dual energy CT imaging is required imaging of the volume of interest at two different photon energies, that they have got different KVs, they have got different capacities, they are different photon energies. The volume of the interest is scanned at two different tube by different voltages, different tube, different voltages, different detectors. Extra filtration of the beam can also be used to further optimize the two X-ray spectra. Thus, a dual energy CT allows better discrimination of certain tissues and pathologies. Here we are seeing diagrammatically. You can see two sets of tubes. One is rotating, the second is also rotating. Both are rotating with the detectors. Out of that, one is a normal tube and second is a low energy second tube, that is a dual source. Here we are showing in the first, second we can see a single source, and then we can see a detector based spectral CT. So these are the different type of CTs of which we are seeing advantages of dual energy. These in the machine, how they are? You can see a detector A, detector B, tube A, tube B. So that is how two tube and two sets of detector move within the gantry. They are at different energy levels. Now procedure details. A dual energy CT scan is identical with the standard CT scan to some extent. Both tubes, they work like a standard CT unit. The patient will not notice any difference in the examination between a single energy and dual energy CT scanners. Now dual energy CT scanner gives all the benefits of conventional CT scans. Additional, this will result in a more accurate information about any pathology, procedure, better picture of the blood vessels, particularly in CT angiography, by improving the quality of images of the metal prosthesis, because there are no artifact. I will not say no artifact, but there will be less artifact, but they can be filtered and you can get an image fairly in a diagnostic form. Now additional benefit we are seeing, it reduces the number of scan images required to obtain the same information as required energy study. So less energy, less time and better details, providing constitutional information about the kidney stone that do not or do have got uric acids. So uric acid containing as well as non-uric acid containing stones can be better imaged. It improves visualization of tendons of the head and foot. It's a definitely MSK imaging advantage. Now what is a dynamic CT? A dynamic process in the volume of the interest which can be followed as function over the time. Such studies are also referred to as a 4D CT. Dynamic CT studies can, for example, visualize the movements of the joint or the contrast enhancement of the organs, perfusion or dynamic CT angiography is then an example of a dynamic CT angiography study of the brain with a volumetric CT scanner that covers the entire brain is shown subsequently. Here you can see how best it is achieved because of this dynamic technique. Just have a closer look and feel the difference between a normal and this study. Now with a volumetric CT scanner, scan covering entire brain in the images, the time resolved contrast enhancement of the vessel in the brain allows the enhancement of the arterial and venous component of the angiography. So in a same set you can get arterial phase, capillary phase and also venous phase. A dynamic CT scanning is also used for contrast enhancement of the liver, either as injection of contrast to the vein or direct hepatic arterial or indirect portal contrast injection. By that we can achieve a better diagnostic accuracy of a hepatic SOL. This technique improves scanner performance in the pharmacodynamics of the contrast and reveal the details of the complex vasculation of the liver and the tumors. By dynamic spiral scanning techniques, entire liver can be scanned in a single breath, that is 10 to 20 seconds. Most important here is we can differentiate different type of SOL. Particular problem is in hepatoma, metastasis and hemangiomas of the liver. There this technique is excellent. By using this benefit of the liver contrast enhancement CT scan, it will be possible to scan entire liver twice during both the early arterial phase and subsequent venous phase after a single shot of IV bolus injection. Hence, the total amount of contrast media to be administered can be reduced while the diagnostic potential of the contrast agent is significantly improved. Now here we are seeing it. A non-contrast phase hepatic dynamic CT examination, then B is the arterial phase. How we know is because looking at aorta, the IVC has not been opacified. Now third is the portovenous phase. How we know is by the opacification of the hepatic vascular structures, and last is the delayed phase. So see how great it enhances or how great it helps in distinguishing hepatic SOLs and give their information. Now, as far as hepatic SOL are concerned, how to diagnose them on CT are covered in some different other lecture. Do visit our website for that. Now, let's come to CT perfusion images. Introduction. It is useful technique used for measuring perfusion in the brain. By measuring blood flow to the brain and the perfusion, which is important for treating stroke, blood vessels, diseases of the brain and brain tumors. Now, the application of perfusion study in a diagnosis and assessment of the treatment response to the patient with the tumor is also important. This technique can be applied to organs like brain, heart, liver for imaging perfusions. As far as our lecture series is concerned, we cover brain and liver only. Cardiac are not covered in our series. To evaluate acute stroke of patients and to select suitable patients for thrombolytic therapy by identifying brain tissues at risk of the infarct of permanent injury by lack of an adequate blood supply. What does it mean? When any vascular incidence occurs, there will be occlusion of the arterial supply. After that, the phases will follow, in which initially there will be only ischemia and then it will get converted into infarct. Now, once it is infarcted tissues, they cannot be revived. So, this technique is used to identify which are the infarcted tissues and which are the tissues which are sustaining a ischemia which can be salvaged. So, before the thrombolytic therapy, we know how much we can save the brain. So, this is the best advantage of perfusion study. For that, we have to perform it in time. Immediately a treatment has to be given. To assess neuron damage in patients undergoing surgical or neuroendovascular treatment, this also helps a lot. Now, to evaluate a vasospasm, that is a sudden blood vessel constriction that may arise from a subarachnoid hemorrhage in which bleeding occurs in the space between the two membranes surrounding the brain, known as dura mater and arachnoid mater. So, if the hemorrhage occurs, that will cause this reflux vascular spasm. This technique employs special catheters. Now, to treat this type of diseases, once we diagnose them, we have to employ special type of catheters, long thin tubes, some containing a special instrument that can manipulate into the area of vessel, then blockage to dissolve or dislodge the blood clot. Either you can remove the blood clot or you can put the drugs that will dissolve it. So, it is all possible provided you know how much tissues you are going to save. To show which areas of brain are adequately supplied with the brain, that is a perfusion, and provides detailed information about blood flow to the brain. CT perfusion is a fast, painless, non-invasive and accurate. It is useful technique for measuring blood flow to the brain, which may be important for treating stroke, brain blood vessel disease and brain tumors. Then what are the risks? It has non-significant chance of cancer development, that is all effect of radiation we are talking about. Really, it is so negligible and there are so less incidents in the world that we can as well forget this, because it all operates in maximum permissible dose. You must know now what is MPD, that we have covered in radiation safety and protection. However, the benefit of the accurate diagnosis overweights the risk involved with the CT scanning, and it is so the advantage of using it can 100% salvage at least some tissues, and chances of radiation are negligible and then can be as well forgotten. So, you can safely apply it. It is applied everywhere in the world and it is considered a safe measure. Always a low radiation dose technique is used, not sacrificing the quality in all CT scanner by the manufacturer with the help of computer programming. So this is a low radiation technique used by all manufacturers, that is, as far as possible to achieve the best results, a radiation dose is adjusted by the computer machine. Women should always inform before X-ray or CT scan if there is any chance of pregnancy. It's a standard instruction and most of the time it is followed. Now CT scanning is not recommended for pregnant women unless medically necessary because of the potential risk to the baby. Now often the question asked whether if there is suspected brain problem during the pregnancy, I think the answer is simple, that is MRI. This risk of CT is there, maybe minimum, because the scanning is done at the head end and the fetus is far away and often it is protected by the lead shields. But however, still, since the MRI has come, these indications are getting, that is the pregnancy and scanning, CT scanning is less and less. It is MRI that is investigation of choice during the pregnancy. Now nursing mother should wait for 24 hours after contrast material injection after resuming breastfeeding. It's not an absolute contraindication, but as far as possible, if this can be followed, fine. If they cannot follow, there is not very negligible risk with this. The contrast that is excreted through the milk goes into the GIT of a child or the breastfed baby, but there is no risk at all. It is very minimal. The risk of serious allergic reaction to the contrast media that contain iodine are also extremely rare in nowadays. What is the non-ionic contrast, that is introduction of this contrast, we are rarely getting reactions. However, we have to think of them, we have to take proper care, and all radiology departments are equipped to deal with these reactions. All the staff around knows what to do and when to do. Now instruction to patient is keep fasting for few hours, that is all same instruction as that of the contrast CT scan. Any known allergy should be performed so that the precaution can be taken either prophylactically or after they occur. This medicine must be taken, whatever you are taking for the hypertension, blood pressure, talk with the doctor and they will guide you whether the medicine should be continued or they should be delayed. As usual, jewelry is not allowed in CT room since it causes the artifact. So leave it at home. Loose wear clothes. Most of the time, all the department has got them. They give you. So patient is given a something like a gown in the department. So no worry, that will not have any radiopaque contents in it. Now CT perfusion imaging shows which areas of brain are adequately supplied or perfused with the brain and provides detailed information on delivery of the blood or the blood flow to the brain. It will be noted that types of CT scanner, brain and blood vessel provide greater clarity and provide more detail than a plain scan. So this is a standard advantage of any contrast enhanced scan versus a plain scan. So let us see how it looks in reality, these perfusion scans. They are color coded, but you can clearly see which are the areas at risk, which are the areas which are infarcted, and which are the areas which are ischemic. We are more concerned with the ischemic tissues which we want to save, and this is shown on the angiography also. You can see a block at the vessel. Now what you will take home message? CT scanning is a painless, non-invasive, accurate investigation. A major advantage of CT is its ability to image bone and soft tissues and blood vessel at the same CT. These are same as that of the routine CT scanner. Unlike conventional X-rays, CT scanning provides very detailed image of the many of the tissues as well as lung, bones and blood vessels. In emergency cases, they can reveal internal injuries, internal bleeding, and it is very quick. You can directly take patient from emergency room or the casualty to the CT scanning room, and often the treatment of many things are given there itself. So it saves a time, it is a quick, and most of the time there are very few contraindications, not like MRI where you have to have a patient very steady. Here patient, if the is little bit irritable, then also we can manage this. CT has been shown to be a cost-effective imaging tool for a wide range of clinical problems. CTs can be performed if there is impaired medical device of any kind. What does it mean? If there is suppose there is a fracture treated with the metallic processes, or there are any clips, still a CT can be performed. We have seen when we were seeing a dual source energy that how even in this patient we can get best possible images, and no radiation remains in the body after CT examination is over. So once you complete this CT examination, once you leave the department, the radiation is left there itself. It doesn't come and it doesn't get retained. Now, what are the applications of CT in radiotherapy? These are new ever, they are tried, and in addition to the detection of lesion, that is tumor, then detection of the SOL, then embolizing them with the help of something like interventional radiology used, a screening MRI or screening CT units, and in that case again that advantages we take also for the cancer, that is the oncology and its role in radiotherapy. Now radiotherapy role is different than all these roles. A diagnostic role is different, a therapeutic role is different, and a application in radiotherapy is different. Now as for detection, diagnosis or planning treatment of the disease, it is useful, but this application is same as that of the routine what we use. Planning of radiotherapy, it helps a lot because it can give you accurate measurements, so also the tissues coming in between, and also gives you a port how you can save the important structures. Now common indications involve tumors, then infection, blood clots, internal bleeding. So these are the complications of the pre-existing malignancy. Now special applications of CT include a well-established application of CT radiotherapy treatment in planning, since the images can show internal organs, blood vessels, soft tissues and bones, and you know which to save. So more experimental applications like dual energy CT scanning and dynamic volumetric CT scanning studies are under trial for radiotherapy, and soon we'll have a results from them. With that, let's come to end of lecture. I thank you for giving me your valuable time. Please visit our website for comprehensive and detailed lectures on this topic as well as many other topics. I thank you again. Thank you. Goodbye and take care. See you in next lecture.